Next, we had Dr. Ravi Krishna Kanaradi, who will be speaking on flower petal technique of chopping the nucleus. And after him, a madam will be there. She is Dr. Sheetal, and followed by Dr. Krishna Prasad, because you have missed the track coming in the other way. Okay, okay, fine.
Sir, I just
Fine.
wanted to
Any-
highlight, does
Yeah.
uh, hello? Yes, sir, can I?
But at the same time, we need to remember that in those plate haptic, there are 4 fixation points. And if you calculate the distance between the 2 fixation point, it's always less. It's quite less. And that's why the rotation does not occur. And the second thing, as far as the viscoelastic is concerned, it may be a good option to use sodium hyaluronate like Hulon, because that comes out very easily while injecting the lens. Sorry, go ahead, please.
So I'll be talking about flower petal technique and especially managing the harder cataracts. So there are many techniques to chop the nucleus. So it can be a stop and chop, nuclear practice, cross chop, crater and chop, lift and crack, pocket chop, retro chop, and multi-level chop. So I usually prefer to do flower petal technique in most of my cases, except the softer ones. So, which all cataracts are suitable to do for this type of technique? So, they are mild to moderate and very hard cataracts. You can definitely try using this technique. So, I usually keep phaco parameters. So, earlier I was keeping in linear mode. Now I am using the IOP of around 22 with fixed vacuum as well as flow rate. And that I'll just go through the technique, what exactly we do in flower petal technique. Uh, First, the superficial cortex and epinucleus plate is removed, followed by the phaco tip is embedded in the mid periphery of the nucleus, and the chopping is initiated. So I usually use zero point 0.5 or 0.75 dialer. I never use chopper in any of my cases, even it might be NS5. So that's one advantage of flower petal technique. The next, the nucleus and epinucleus are chopped into flower petal piece. So you don't have to crack the central portion. You just separate mid periphery and keep on rotating the nucleus and do multiple chops, not towards the center. Then you'll be able to lift the nucleus in toto, the central hard portion. Once you emulsify the endonucleus, then you can separate and eat individual pieces. You can emulsify individual pieces. The endonucleus is the first one to emulsify and followed by the epinucleus. Then the routine procedure like cortical removal and IOL implantation. So this is one video. So it's sometimes very difficult to crack a nucleus. So, but we have to adopt our own technique or some easy way to manage this. So here the person is trying to break the rock, but initially he was not succeeded. Then ultimately he put 2 chisels sideways and just removed. So this is how the flower petal technique works. So this is NS4 grade cataract. You can just see that I am just trying to hold the mid periphery and using a dialer to separate. So at the end,
Oh, because of the light. No, no, the light.
We have been trying for so long about last.
video you cannot see the
You
video
cannot
for
see. Nothing will come in the proceeding.
so the central nucleus part is lifted. I think you people can appreciate. I'm not sure. Then the peripheral part is separated. So by this you can minimize the energy utilized. So my CDs with in Centurion, especially for all this hard cataract, it might be more in most of the case it will be less than 20. So once we remove the central part, then it's easy to separate the plate and emulsify. And in between the surgery, like every 5 CDE, I use a visco. I'm the person who is not in favor of viscode, so I very rarely I use, if at all, if I see that the cataract is very hard and endothelial cell count is very less, then only I use viscode. Otherwise, most of my cases will be with visco. This is one more case with a smaller people. So the advantage of learning flower petal technique or vertical chop is you can manipulate in any size people. Even if it is 4 mm, you'll be able to do a good job. This one more video. So this is NS3. So after aspirating the cortex, superficial cortex, and I do bevel down phaco in all my cases. It is not the bevel up. That's why I can work near the anterior capsular margin or in the pupillary plane. So once, like, how to start doing flower petal technique is you can just start in NS2 cases, and slowly it's little, the learning curve is there, but you can definitely learn if at all, if you are a person who loves vertical chopping. The main advantage with flower petal technique is you can reduce the stress on the zonules. If you try to separate a hard cataract, and you might compromise on the zonules, so you can definitely put less stress on the zonules if you are doing flower petal technique. And there are no many published studies. There is one article by Dr. Rajesh. He is from Government Medical College, Pune. So this paper says that the flower petal technique is an effective and safe technique for phacoemulsification of hard and leathery cataract. Separation of the hard core of the nucleus from the epinucleus obviate the need for a thorough through and through crack of the nucleus, making it easy technique for the beginners as well as an experienced surgeon. So advantage already I discussed. So it will induce less stress on zonules, decrease the phaco time, easier manipulation of hard cataracts, and it can be done with a dialer also if you are comfortable. Thank you.
Thank you so much. Finishing before time, 1 minute. Open for discussion.
Sir, at times when only the posterior plate remains,
Yes, sir.
thick posterior plate, a very hard posterior plate, in my practice at least, I find it extremely difficult to remove by this particular technique. And especially when the crack has not been initiated right through and through, right up to the posterior plate. Even removing that those pieces, one small fragment which the peripheral portion, when it tends to come towards the center, the whole lens tilts and it comes out of the bag, and it comes quite close to the corneal endothelium. Your entire surgery will remain in the anterior chamber rather than in the capsular bag. I find it difficult. I'm just
that's what. See, in case if at all if it becomes reverse, then you can chop.
No, it doesn't
that
become
portion.
reverse. It doesn't become reverse.
Okay.
It just stands up.
Okay.
And that portion which you are trying to remove,
Okay.
that you are removing almost in the anterior chamber.
Okay.
And when you are doing that, the chances of damaging the endothelium is much higher.
Okay.
If there is a full crack, then it's easy to remove that fragment. But when the central plate is not divided, it's quite often very, very difficult to remove the.
That's what, sir. Actually speaking, you have to exert a vertical pressure, vertical chop. So whatever you have already separated, you have to just try to push one edge down and one edge up,
No,
it cracks in most of the cases.
I
My
understand that.
experience. Yes,
What
sir.
I'm trying to say is
Understood, sir.
when your central part is not divided.
Yes.
If you are saying that only the peripheral portions are divided and the central nucleus will come out, that can happen not in hard cataracts. Up to grade 3 it will come out. But when you have a very hard cataract and a hard posterior plate,
Okay.
it's almost impossible to remove it, at least in my hand.
One more thing I feel, when you have left out with the central part, and in cases of hard cataract the posterior capsule is also very thin, so again there is a sharpness and you are not using viscoat, so in all these cases may lead to the PC rupture.
Yeah, I think I agree with both of you. What I do normally, if you are doing the same technique, you just rotate it. Just I said, it is vertical. You put more visco and rotate. Take the back side up.
Yes, that's what I was.
And it becomes very easy.
Yes.
That's the
It's
technique.
Yeah, that's what I was trying to tell.
You can tumble the lens, I understand, but especially when you are showing that pupil size is 4 millimeter, it is extremely difficult because your rexis, even if you have gone underneath the iris, would not be more than 4.5 to 5 millimeter rexis. And from 4.5 to 5 millimeter, even tumbling the lens upside down is extremely difficult. It doesn't happen so easily.
Yes. And that's what hard cataract require a lot of patience. So that's one most important thing.